washing is considered the single most important procedure in preventing the transmission of diseases.
The purpose of hand washing for patient care is to remove contamination acquired by recent contact with a patient or his or her environment and to reduce one's own skin bacteria.
It is proven that when hand washing compliance increases, the number of hospital-acquired diseases decrease.
We owe it to our patients to provide safe care, and hand washing is most important.
Hi, welcome to a typical day in the hospital. You're about to see what happens when hand washing is not used appropriately. This is Shayla. She was a patient in our video. She has MRSA, which is a bacteria that is not been able to see by the human eye, however, is spread very easily. So we can look at Shayla and see that she has germs on her face, her gown, and her bed. If we look around to the objects around Shayla, we can see it's on her cup, the oxygen tubing, and the bedpan that was used by Mandy, the other patient. We can look down at her Foley catheter bag and see that there's MRSA on here. And now in my hand. If we look at her tube feeding pump, you can see that there's germs here and here. And what we don't think about is when we touch these pumps and then we take care of our patient, we are transmitting bacteria. And we come over here to our other patient, Mandy. Mandy did not have infection, however, now she probably does because we touched Shayla and then we came over to Mandy without washing our hands properly. So if you look at the pump, you can see that there's MRSA on the pump, as well as her chest tube, which should be kept as clean as possible. Mandy has germs on her gown and her bed, her side rail, and her food tray. As you can see, it's very important to wash your hands between patient contact.
My hands are dirty. So what do I do about it? What do I do about it? What do I do about it now? Dirty. So what do I do about it? What do I do about it? What do I do about it now? Gel in, gel out. Let's clean it up. You got infection? Don't spread it round. Go wash your hands. Like, oh my gosh. Kill all them germs. Let's get them off. I know there's germs all around, but we'll get some soap and we'll just kill them all. I feel grossed out. I wanna wash my hands. Where's the nearest sink? Man, I gotta wash my hands. You got MRSA? VRE? Look at that C-diff. Just wash it off. Get some soap and scrub for 30. Rinse it off, and then we'll do it again. Let's do it, let's do it, let's do it, let's do it. Do it all the time. Go wash your hands.
From our video, the spread of infection can come from all healthcare workers. We are all responsible for our patient safety and for the prevention of infection.
Wash your hands before meals.
Before and after patient contact. Make sure you wash your hands before removing a dirty dressing and before applying a clean one.
When your hands are visibly soiled,
Before handling medications and food.
and after you touch anything in the patient's room.
When in doubt,
Wash your hands.